When somebody gets trauma, the fight and flight system gets in overdrive and gets stuck. So it resets the cycle to pre-trauma state. I was going 120 miles per hour. Now I'm cruising at 20. In order to understand what it does, you need to understand what PTSD is. I hate the term PTSD. Post-traumatic stress disorder is a horrible term. So I'm trying to change the name PTSD to PTSI, post-traumatic stress injury. People feel better in 10 minutes. They can take a deep breath first time in 20 minutes.
Hey guys, this is another year, man. We're at the Core Medical Military Appreciation Weekend that we do every year to raise money for the Core Foundation. And what that does is provides TRT replacement for veterans who cannot afford it for their first year, and then help them get on their feet. And we know once you get your hormones, in check and aligned and optimized, your whole life changes. Anyways, but today I'm joined by Dr. Lipov, who thank you, sir.
Thank you for having me.
Who I knew when I was in Marine Special Operations Command, and I didn't know his name, but I knew what he had developed. And it's interesting now, after all these years, to be sitting with the man that actually developed the what we call it, the God shot. Is that
that's what the book is called.
That's what the book is called.
The technical term for the procedure is called SGB. Stellate Ganglion Block.
Stellate Ganglion Block. And what does that actually, I know, but what does that actually do?
So I can get you a lot of detail, but essentially what it does is when somebody gets trauma, all types of trauma, the fight and flight system gets in overdrive and gets stuck. So think of a computer that's in the cycle. Yeah. So it resets the cycle to pre-trauma state. So you can calm, you can sleep, you can have sex, you can function much better. And a lot of times people can go back to what they didn't think they can get that life back. So plus hormone replacement, you get even more life together, which is great. So
these are people that are in stuck in an extreme fight or flight situation to where they're...
So if you don't mind, let me give you a real example. So the first person I ever treated was 2006. He was a victim of a crime. The second person was Special Forces from Peoria, Illinois. So he was Army. He was patrolling streets in Baghdad. So there was a kid, 10 years old kid, was sent to take him out and laden explosives.
Common.
Right, at that
tactic,
time, right?
Yeah, at the time, yeah.
So he had to shoot the child. And the piece of the child hit him. Jason comes home. He tried to kill his wife a few times at night. So she gave him basically a very simple direction: either leave or get fixed.
Yeah.
I happen to have known the father of the owner of the company he was working with. So he sends me this guy, a lovely man, and we do the block. 10 minutes later, he says, when I came here, I was going 120 miles per hour. Now I'm cruising at 20. I remember everything that happened, but now I remember black and white. It doesn't have the emotional hit. It's been 17 years. He's still doing good. Still married the same woman. There you go. That's the real story.
And what is it doing? How do you do it? And then what is it doing?
Well, the way it's done is, so I'm an anesthesiologist, pain doctor, so we stick needles in people all day long, right? So the way it's done is you can either go to sleep for it or not. If you want to be awake, great. If you want to go to sleep, fine. Somebody lies on the table. I clean off the neck. I use ultrasound to find the right spots. Numb up the skin and put the needle under ultrasound guidance. Numb up an area in the neck. It's called stellate ganglion. 5 minutes. That's about it. That's what it takes. So if you'd like to know what it does, I can explain that.
Yeah.
So in order to understand what it does, you need to understand what PTSD is. First of all, I hate the term PTSD. Post-traumatic stress disorder is a horrible term because it's stigmatizing.
Yes, it is.
Right? So injury is what happens to you, right?
Yeah.
Disorder is what's wrong with you. So I'm trying to change the name PTSD to PTSI, post-traumatic stress injury. We'll talk about that later.
Okay.
So to me, psychology is actually biology. If you're smart enough and you have enough information, you can understand what's going on as opposed to saying, well, they look bad. Yeah. What's bad? I don't know what that means.
Yeah.
It's not
especially
specific.
for guys like myself.
Yeah,
that's a very random.
Thank you for that. I really appreciate that. That's yay.
very wide scale. Of
Exactly. There's
what's
different bad, right?
Yeah, right.
You like specifics. You need
Yeah.
coordinates.
Right.
You want black and white.
Yeah.
It needs to be actionable, right?
Right.
Also, like guys like yourself, it needs to be actionable.
That's right.
Okay, that's great.
Yeah.
But what do I do about it?
Right.
You know, sitting around in the field meditating is marvelous, but probably not going to do anything. So the first thing that happens, so let's say trauma happens. Let's say we're talking about Jason still. So severe trauma. So two things happen. Fight and flight nerves secrete something called norepinephrine. It's like adrenaline. So that's why if you're about to get hit by a bus, you feel like all revved up. But then you didn't get hit, so you're fine. It comes down.
Yeah.
But if it's severe enough, something called NGF, nerve growth factor, is produced in the brain. That's been demonstrated in the rat model. So it goes from the brain to the stellate ganglion, which where it travels, it happens. Mm-hmm. Once it hits the stellate ganglion, it promotes extra nerve fiber growth of sympathetic nerves. What that means, let's say it started at 4, but now after the injury, now you got 8.
Yeah.
As long as you have NGF in the ganglion, it means stay in the 8. As long as you have those 8 there, it kicks out more norepinephrine. So if you take a soldier or Marine, whatever other service, the fluid around the brain is called CSF. Mm-hmm. If you compare the amount of norepinephrine, somebody who's normal, without PTSD compared to PTSD, the guys with PTSD will have twice norepinephrine. So we know that happens, right? So that's what causes the problem. It causes sexual dysfunction. It causes sleep problems, a trigger finger, very rapid anger, all of those things, which I'm sure you know all about that. Not you personally, but you understand.
No, I'm very aware though. Yeah.
Right. So again, as long as it persists, those are the symptoms. So when you do local anesthetic injection, I use bupivacaine. It's not a psychiatric drug, not addictive, none of that. The same drug that's used for epidurals for women during pregnancy. You know it's safe. So when numb this up, two things happen. Number one, norepinephrine drops like a stone. Excuse me. And people feel better in 10 minutes because norepinephrine drops. They can take a deep breath first time in 20 years. Because a lot of times they're like, they can't take a deep breath and they feel anxious and they feel something bad is going to happen. Right? Probably know what I'm talking about.
Yeah.
The second thing that happens, when you put local, it reduces NGF. So when the NGF goes down, the extra nerves go from 8 down back to 4. Takes about a week or 2 weeks. Mm-hmm. So that's why a procedure that lasts 8 hours can last for 17 years like in Jason. That's it. That's the
So you don't have to continue to redo it.
It depends. It depends on 3 things. Mm-hmm. Number one, what do you do after? So after you've done stellate, a lot of times people can really do a really good job of psychotherapy. They can get to the bottom of it. I'm talking about a couple of weeks, a couple of months. We're not talking about 30 years of it.
Yeah.
I've met people who have 30 years of psychotherapy.
But now I can process stuff and I'm not having to be emotionally triggered.
You're not pissed off.
I'm not pissed off about it. I can just
Right. You're not shutting down.
Yeah.
You go, well, okay, like Jason's like, I had to kill the child because he was going to take out my squad. That was my job.
You can rationalize it without the feelings associated with it.
Correct.
Yeah.
Because it's totally separate.
Right.
So number 2, genetics. I mean, what God gave you, God gave you.
Yeah.
Number 3 depends what happens to you. Like we took care of a policeman in Chicago. He was doing great. Mm-hmm. Then he had to kill a perpetrator in the line of duty.
Yeah.
He had to come back and see me. You know, I mean, it's not a lobotomy, right? This is just resetting the system. But if you whack the system again, it's going to come back.
So here's I'd like to hear your thoughts on this. And by no means, because I'm interested personally, but by no means am I like trying to find wrenches in it.
No, please.
One of the things that I have, because it's been offered to me several times. Mm-hmm. One of the reasons why that I've kind of hesitated is because does it take away any sort of drive to like become better, do better, work harder, build a business? You know what I mean? Do you?
I know exactly what you're asking.
Do you just get back into a flow state and you're like, everything's chill. No, I don't need to worry about anything.
I'm going to give you an answer.
Okay.
So I have had the honor of taking care of about 500 operators from US, all services, and about 100 operators from Canada. That is the number one question they all want to know. You guys will compete about who can throw the Kleenex the furthest.
100%. Of
And
course.
that's how you are.
Every time. Even here.
Yeah, it's like, wait, come in. that was the meter. No, I want 2 meters. Right?
That's right.
It's just in your nature. You have to do it.
Yeah, it's just the way we are.
So
Throwing rocks to doing anything. Yeah.
right. So there was a study done by somebody else, not me, and it was on operators, and they found it did not degrade mental performance, whatever that means. Right?
Whatever that means. Yeah.
However, what we find, especially in snipers, what they find, in order to be a really good sniper, you know what that means. You cannot be frenetic. You cannot look everywhere. You need to be focused. You need to be laser, right? None of this looking everywhere. You're going to be a pretty shitty sniper.
That's what your other guy's for. You have another guy.
Oh, you mean the spotter?
The spotter, yeah.
No, I got it.
Yeah.
I got it.
That's what he's there for. You're,
right, I got it. You have to be like, that's the target.
Yep.
Take the target.
That's right.
So this, think of what it does. It takes from here, now you're focused. Now you're laser. You'll be much more successful in business. To be successful in business, in my opinion, here's what you need. You need to be focused. You need to have a goal. You cannot try 5,000 different things.
Clarity and vision.
Number 3, if you don't sleep, you ain't going to be so good, right?
Yeah.
Let me tell you what this does for sleep. So let me kind of give you a couple of interesting information about sleep.
Okay.
There's something called glymphatic system. I don't know if you've heard that term. Glymphatic? Cool. So when you burn fuel in the brain, which is glucose, you're producing byproducts. And that gets stuck in the brain. And the only way to get rid of it, you need to be in deep sleep. So that's why I watch my Oura ring and see how much deep sleep I get. So if you have PTSD, you cannot sleep deeply. So all that gunk is in the brain. So if you get up in the morning, you're like, whoa.
Dragging.
You're not so good.
Yeah.
Right? So the point is, you should show up fresh, smart, and focused.
Yeah.
It also improves cognitive function, which is lovely. I have not met a single SOF guy who does not have some TBI. There's no way.
It doesn't exist. Yeah, it doesn't exist.
Right?
Yeah.
And this is how, let me tell you, how I learned mine.
Yeah.
So I was doing the SOF experience. So we're blowing down doors with cord. So I go to the instructor, I say, hey, I'm woozy. He says, that's called eating a charge. I was like, no, great. He said, you're such a wuss. We use C4.
Yeah.
You're using cord.
Yeah.
I was like, my head is still woozy. He said, whatever, move on. Anyway, the point is, there's no way, you're supposed to only shoot 3 Gustav rockets.
Yes.
Most of you guys done 100, 300.
That was in my book. Yeah.
Big mothers, right? That causes BTBI,
Yeah.
which is blast traumatic brain injury. So basically, take the brain, you go. It ain't so good when you shake it like this.
Right.
It's not dice, it's brain, right? So the point is, if you can improve sleep, if you can improve TBI, you can improve your focus, you'll be better at business.
But I believe all of that, because that's 100% fact. But what you're describing on the inverse is this negative flywheel effect that you're never going to get sleep because you have all of these things going on. You're staying super hypervigilant.
Yeah.
Which is not going to allow you to sleep. Like I didn't sleep so I went to an inpatient brain clinic in Texas in 2014. I didn't sleep from 2009 to 2014.
Well, you slept just poorly.
Slept just super poorly.
Right, of course.
Yeah. Like not a really deep sleep. Then things started to degrade in my life. And when I went there, I had never gotten blown up, like launched, IED, etc.
Right.
A lot of my friends had. And so I was like,
do you use 50 cal machine gun?
Yeah, this is where I'm going.
Well, that's no good.
Yeah.
No good for the brain, I'll tell you.
So he started laughing because I did this questionnaire for other people. And they called me and they're like, hey, we want you to come into the brain clinic like starting Monday. And I'm like, no, I'm just I filled this out to get more information for my people so I could recommend people. They're like, yeah, cool. Can you be here on Monday? Because you need to be here. So I talked to the doctor and he was like, well, how many flashbangs went off? Because he treated a lot of special operators. How many flashbangs went off of your feet? How many parachute openings do you have? How many times have you shot in the house? How many AT-4s or rockets have you launched? And I was like, oh, geez, I don't even know.
I can't remember because
I got that. And he just went on and on. Like, were you ever in a gun truck with a 50 cal going off overhead? You know what I mean? Like, he just went on and on and on.
Exactly.
And he just had all these examples. He goes, dude, at the end of the day, he's like, all of those were micro traumas on your brain. He's like,
Right.
and every single one is they're going to degrade and then put that chemical, whatever that is that you just mentioned.
Well, I'm going to give you another perspective of
Okay.
that too, but go ahead.
And he's like,
I 100% agree with you.
He goes, all of that is chipping away at your health. And he goes, and what happens is you guys don't stop. So you just continue to go, you continue to go.
Because you're as a troop, you got to be together.
You medicate, you do whatever it is that you have to do to keep going, pain pills, etc. You know, sleeping pills, Provigil to stay awake, sleeping pills to go to sleep.
Yeah.
You know, Tramadol to deal with the pain. And he's like, you're chewing up Motrin, and he's like, he goes, if I've seen one of you, I've seen thousands of you.
Everybody's the same.
It's you guys are all the same.
I agree. I get it.
And,
that's why I know about the Kleenex.
Yeah. Anyways, so that was, and then when I went through the clinic, it was the first time I got a full 8 hours like out. I fell asleep and I did not wake up.
That's cool. What did they do?
It was all the brain stuff, the dots. I mean, it was just so mentally exhausting, where you have to look at you have to choose the color. Dr. Brendan Bowerman came up with a VR version of it, like a shooting video game, but it's basically like touch red, and you're having.
I got it. You have to pay that.
Yeah, and then there's
sucks up a lot of mental energy.
And then there's like 5 dots, one center, and he's like, start on the middle dot, go, and then follow it to the right dot, and it's just like reprogramming your brain. And then there's a chair, and there's a whole bunch of stuff.
Good
that
stuff.
They did. Yeah, and it changed my life. One of the things is, before we, and this will kind of pivot into hormones, was he looked at my blood work and was like, you're classic type 2 hypergonadism. Like you've like crushed your endocrine system. Your pituitary gland is wrecked in your brain because of this TBI.
Of course. I
was borderline still suicidal at this point.
Right.
And he goes, "Do you ever had?" I was like, "Oh, I already had like an attempt," which I wrote about in my book. And he goes, "Well, here's the reason why." He goes, this is like a medical, like, one, you have a TBI, your pituitary gland's not producing down to your testes. Your endocrine system is whacked. You're not sleeping. He's like, this is the reason why suicides happen. This is a classic, formula for this. Anyways.
Agreed. 100%. So can I give you two pieces of information? Maybe? And I'm not talking about you specifically.
No, that's fine.
So I wrote a chapter about sexual dysfunction and PTSD. So and the reason I came up with that, I saw a video about the SEAL was treated, his name was Luke. There's a YouTube video out there by Luke. And so you see the family, the guy and his wife sitting there with a child, and I see him a month later after the Stellate. So after a month later, the wife says, "Oh, I love my husband. It's so nice." The guy says, PTSD was a bitch, but I don't care. I can actually now get laid. Yeah, that's why I really. That's right. I was like, that's great, but who cares? Yeah. So I was like, what? So I looked into it. So I wrote a chapter about that. So it turns out, norepinephrine, we were talking about it before. So basically, there are 3 levels. There is low, there is optimal, and there is too much.
Okay.
So if you have too much, which we talked about PTSD, think about the way I explained to the guys, if you're running from the tiger, you don't want anything sticking out.
Right.
So norepinephrine, you need to take it down a notch. Okay. So that really helps. So that helps prevent suicidal things, prevent keeping your family together, all of that, right? But the other thing is, so I developed a method called SOF method. Shocking what I got that term, right? So I treated a guy who's a Green Beret, multiple TBIs, he was abused as a child, suicidal and homicidal for, I think, 20 years. And he talks about it, actually, quite publicly. But it's a ketamine and stellate together. Okay. There's a synergy between the two of them. So actually, Northwestern and Walter Reed is now studying that in detail. But together, when people have BTBI, which is clearly you had that, and PTSD together, because TBI makes PTSD worse. So it's a combination, goes back and forth. The other thing that's really important to realize that when you have TBI, it increases inflammation. Mm. So inflammation, when you have, somebody has TBI, let's say they're playing football. They have them sit out for a while, right? They're trying to get the inflammation down. They may not realize it. So stellate reduces inflammation. So when somebody has TBI, it's really important to reduce inflammation. And where stellate actually does very well, it drops the inflammation. Inflammation makes the brain little swelling, and it's not good for it.
Oh man.
See what I mean?
You know what's interesting? You say that because like in veterans and former special operators, we have a huge fight with inflammation. Everybody is so inflamed.
Yeah,
and
that's right.
what we're seeing now is after all these years, there's guys in their 40s coming down with cancers.
Correct. Let me tell you why that happens from my perspective.
Yeah.
Now, I'm not an oncologist.
Right.
I don't have a study. I can tell you one thing. Stellate ganglion is connected to 3 things. Well, 4 things. Brain, thymus, that produces T cells,
Right.
and bone marrow, which is bone cells, B cells, right? So everybody develops cancer, like all the time. But not that many people get cancer because the immune system chews it up. It's called scavenging. So if somebody's stressed, their immune system is shut down, more cancer, more TBI, more heart attacks by a factor of 2. All of that is inflammation.
Right. And that's why, like, as now 44 and understanding all of this, it's like my fight is like, I just don't, everything that I do is to reduce inflammation.
Right. But the question is, how effective is it? That's the question.
Yeah.
So you can check inflammation, CRP, C-reactive protein.
Right.
But that's where stellate really comes in because it's been shown to reduce inflammation. Like interleukin 6, you can actually measure
You've
that.
sold me. I'm like, let's do this. Let's go get a table and a needle and
There's only one thing missing.
Yeah.
Ultrasound.
Yeah.
If you get me that and the needle, I'll spit on it. Let's do
we
it.
could do it.
But do you see my point?
Yes.
So if you look at it from that perspective, because you can take pills to reduce inflammation, NSAIDs,
Yep. But
like
see,
aspirin, but
the
it
problem
fries your kidneys.
fries your kidneys, and
gives
special
you-
operators are taking. Like I was taking 1,600 milligrams at a time and chewing it up.
Correct.
Yeah,
But
for a
what it
long
does
time.
causes cancer,
Right.
causes heart attacks,
Right.
causes skin dysfunction. No good. Nuh-uh. Because the problem is,
But at the time,
I know.
At the time, you're like, well, I might get shot, so like I'm not worried about.
I know.
I'm not worried
But that's
about
no
this.
longer the problem, right?
Right.
I hope.
No.
Hope
It's not-
safe area, right? Okay, we're good. Safe space. But my point though is, when people take medications like that,
Yeah.
they're treating inflammation, not the cause of it,
Yeah.
but the effect. The cause is the stress or
Right.
PTSD and TBI.
Right.
So you got to treat that. So if you treat that, it's going to be much more effective.
Yeah.
But that's why people with PTSD, the chance of heart attacks is twice as high compared to someone who doesn't have PTSD. People think, it's just a mental disorder.
There's a chemical
Reason for that.
answer for that. There's a reason for that.
Yeah, well,
Yeah.
there's multiple
Yeah.
reasons. One of the big ones is inflammation. People say, inflammation, that's why you should take fish oil and all of those
Yeah, of
things,
course.
right?
And I do all that.
Right,
Yeah.
good. But the point is, it's like which one is fighting. So if you can reduce...
You can pinch the hose off.
Right.
and
Or
stop
turn off the
it.
water.
Yes.
Turn off the water.
Turn
So
off the water.
Stellate turns off the water.
Got it. Right.
And if you can get sleep, also bad sleep leads to, guess what? Inflammation.
Yeah.
No good, right?
Yeah.
Hypertension, inflammation, impotence, whatever, all that kind of crap. That if you could turn off the water instead of dealing with, you take Viagra for this, you take cholesterol reduction for that,
Yeah, I know.
you take aspirin for that. It's
Yeah,
like it's endless,
It's endless. Yeah.
right? And then, of course, current therapeutics. Let's talk about that for a second. My favorite drug, is atypical antipsychotics. That's the number 2 prescribed drug in the VA right now. So like Seroquel and things like that.
Yeah. All SSRIs.
Right. You've heard of that, right? So heavy tranquilizers.
Yeah.
Well, here's what they do. I don't know if you know. I'm curious to see if you know this. If you take those, one out of 1,000 per year use, the heart just stops and they die. So for 2 years, 2 out of 1,000. That's other amazing things. Pancreatitis, hell yes. Vanderbilt study showed it in 2019. You've never heard of it, right? Mm-mm. So then, pancreatitis, diabetes, lovely. And then it triples the risk of suicide. Beside that, great drug. And it doesn't work. It makes people mean. That's why the girlfriends a lot of times throw it out.
This is an unpopular statement, but the more, you know, that I'm around, the more that it's just, I believe it. And it's very sad, but it's, you know, veterans think that the VA is trying to kill veterans. They really do. And you know, and it really comes down to the pharmaceuticals that we're getting prescribed. Like, you know, and I wrote it in my book, is I was prescribed 11 different prescriptions when I walked into the VA.
Yeah, absolutely. The cocktail.
11.
The death cocktail.
Yeah.
There was an article about that about 5 months ago, New York Times, I believe.
Really?
Yeah. I think the deadly cocktail or
I
something.
barely said anything, and they just like, here you go. Here's your starter pack.
Of course.
Yeah. I'm like, what about physical therapy? What about this therapy? What about this work? Because from my background, like I'm okay to do the work.
Well, in fact, you enjoy the work.
I enjoy the work.
I know,
yeah, I want
exactly.
to do the work.
That's how you do. You want to do it. It's like, oh, I did this now. Now I can lift more. I know. This is use what you got, right?
Yeah. I don't want to take a pill.
I mean, look at the patients I dealt with, right? 80-year-old in a wheelchair. I'm not going to give them the same advice as I would give you, right? But just to kind of look at that statement, if you don't mind. So I'm totally apolitical. So facts are facts.
Yeah.
So in the most optimistic perspective,
yes,
I think the people who are running the pharmaceutical game for the VA, I just don't know any better. And that's how they trained. So
one could hope that they.
I hope
that
so.
way.
I don't know. I mean, I
there's
don't
not a deeper strategic plan.
I don't. Well, considering your training, you probably look at strategic plan for everything. Yeah. And I'm not debating it. I don't know.
Yeah.
But I'll tell you one thing. I gave a speech in a big university about 5 years ago about Stellate. And there was a bunch of psychiatric residents. This is people who are, and this, of course, they were associated with the VA, right? So a bunch of them were taking the VA. And I said to them, I said, you know, your therapeutics don't work.
Yeah.
There was an article by a colonel, Dr. Hogue, from Walter Reed Hospital, 2013. He said the efficacy of current therapeutics is 40%. Placebo is 32%. What are we doing? The colonel of psychiatry, he was an MD, from Walter Reed. So somebody should have read that article.
Yeah, no
That's
kidding.
2013. Hello? Yeah. Hello? What are we doing?
Right. So how does this play into hormones?
So the hormones is another story altogether. So, well, first of all, as you say, pituitary.
Yep.
FSH and LH.
Right.
Basically, pituitary says, hey, testicles, start producing testosterone, which is an important thing. The other thing, it's not just TBI that causes low T. It's also exposure to uranium and all the other crap that comes out of the barrel, right? All of that reduces it. And low T, like when I was in medical school, testosterone replacement was like, it's horrible.
You're going to have a heart attack and you're going to die.
That's exactly right.
Yeah.
Well, I'm on testosterone supplements, so I'm still around 67. Not bad. Yeah. Clearly hasn't killed me yet.
Yeah.
But we were completely wrong, basically. So normal testosterone for a man does a couple of great things. Your heart works better. You build up muscles. Right? It improves mood. All good things. The other thing that's interesting, so inflammation reduces muscle tone. Muscle tone reduces testosterone. So it goes back and forth. It's back to inflammation, right?
Right.
So the whole thing, this whole cycle, low testosterone causes depression. Depression also causes muscle loss. So how are you going to win, right?
That's a recipe for disaster.
It is, because it's a cycle. It's a continuous
So now
cycle.
you have a guy that has traumatic brain injury, post-traumatic stress, not sleeping. Now his hormones are going down. That's you just painted a hell
So you
of a
can't
picture.
win.
You can't win.
Right. So basically, you go, well, fortunately, I believe it's 2026.
Yeah. There's no statement of like, we'll just toughen up. That's not going to do anything.
Yeah. So let's talk about that for a second.
Yeah.
So toughen up is my favorite. It's like snap out of PTSD.
Right.
So it's the same thing. So to me, and I don't know how much time we have. We could talk about the name change, PTSD to PTSI. But it's like saying, you have a broken leg.
Yep.
Put some dirt in it and move on. Rub some dirt in it and move on. Oh, by the way, just to make it more interesting, we're going to give you a rucksack with 100 pounds. And by the way, there's a hill there we'd like you to walk up. That's about intelligent. Yeah. That's a tremendous response, right?
Right.
Instead, when you give someone testosterone, let's talk about the positive side of it.
Yeah.
I'm not talking about levels of 1,200,
No.
2,000. Talking about normal levels, 5 to 700, something like that.
Yeah.
Normal levels. We're not talking that much. So then, here's what it does. Builds up the muscle. Great to have muscle. The equipment, male equipment, likes testosterone. Is designed for that, clearly. No problem there. The heart really likes it. The brain likes it. It works better, takes away depression. As we said, depression leads to muscle loss, and so on. So we're going to break that cycle just by simple testosterone that God decided to give us. It's a gift. We need testosterone.
Yeah.
As a male, we absolutely need testosterone. And the other thing is, we want to talk about which organization, but starts with V, only measures total testosterone.
Right.
Which is ridiculous.
Yep.
Total doesn't matter how much testosterone you got. It's a question of what's available.
Right. What's your SHBG? What's your free?
Right. Free is key.
Yeah.
This APG just tells you how much it gets sucked in.
Right.
But free testosterone.
But see, I get guys that go through and they get a test and they're like, well, I'm a 600. But then I'm like, okay,
how much free?
Yeah, free. How much free? And then what's your SHBG?
Right.
Your sex hormone binding globulin.
But it's not being tested by the VA.
And they didn't test it. And I'm like, well, dude, it doesn't matter what you
know what?
600, it doesn't matter.
I don't know what's going on with you. Can you take off the blindfold? Can you look for a second?
That's right.
Give me a second.
That's right.
Can you look for a second?
Yeah.
The other thing is some people go overboard, right? So now,
so the guys that I'm talking about is like they'll have a 650 and they're like, well, the VA's not going to do anything. What's your SHBG? They come to us, we find out it's a 65.
Well, that's my point. It's like taking the blind. It's like, oh,
Yeah.
look at this. I can see. Woo, baby. It's not a surprise. The other thing is then you also need to check estrogen, right? Because estrogen, I think Sid has a great term for it. It's estrogen rage. I've never really seen it in writing, but that's how he describes it. Oh, my God. Nipple being sensitive, I've actually had that because I had somebody gave me too much. It's like, whoa, what the hell is that? And I felt kind of cranky.
Yeah.
So the point is measure. You don't have to treat it if you don't know what's going on. In fact, you can't treat it. So if you don't have enough free testosterone and you have too much stuff sucking it up, there are medications that will help you with that. But if you know what you're doing, like, sit in the company, I love being that patient because they pay attention. Whoa, that's just nuts right there.
Yeah.
And then you measure the right things. You need to measure the right thing and you act based on the right things. You need to follow it through. Now, testosterone in place is not for everybody. Somebody has prostate cancer? No, you cannot do that.
Yeah.
So that's why PSA needs to be checked. No question. No bullshit. That's no joke. Also, if you're trying to reproduce, that's going to suppress your testicle function. So you're probably not going to be crank out as many boys. But you need to understand, but the vast majority of people will do so much better. And this whole thing about, cause heart attacks. I think that changed about 20 years ago. And we're just now waking up now. I finished medical school in '84. But I write a book.
Yeah,
it's like a new thing.
I have actual white papers that are published on that are published on, I don't remember the website, the government website with all the studies.
PubMed?
Yeah, PubMed. So you hear these people that talk about, like the FDA was saying testosterone will cause heart attacks and blah blah blah. And I'm like,
what year was that paper?
It was just a couple years ago.
They still saying it's bad?
No. This was saying it was good. This was saying it was good, and that's what I was saying. It was like there's conflicting stories. It's like one side is saying that it's bad, and then I'm like, but dude, this is straight from the NCBI.
So I have to send you there was a testimony by the head of FDA talking about testosterone.
This was 2017.
Okay.
2017, testosterone in the heart. And it's talking about how it strengthens the heart and it's good for the heart.
Yeah, no question.
Yeah, and it basically takes away everything talking about like heart disease and heart attack and all that kind of stuff.
Absolutely.
Yeah.
There's no question there.
Yeah.
It's not debatable. And also, there's tons of papers talking about depression.
Yeah.
So let's say you came back serving your country, you're depressed, your muscles are weak, and Mr. Happy is not working.
Yeah.
And we're not replacing testosterone. Why? I don't know.
Yeah.
I'm not in policy, right?
Yeah.
I can tell you medically what people need.
Yeah.
I don't do policy.
That's beautiful, man. So get it, like, so now, like, I'm just thinking, like, far as general stress in general, like, if you've got past stuff or if you're stressed out, I'm like,
Yeah.
Look, if you're living in a hyper fixed, stressed environment and you can't down regulate.
No question. Let me ask you a question.
Yeah.
I'm curious to see if you believe that's true. I was on a podcast of a guy who works with CEOs and stuff like that. I asked him one question. I said, what is the commonality between special forces and CEOs? What do you think? One thing.
I don't know what the answer is for me, because I'm both. I think there's this, like, internal desire to drive forward no matter what.
Got it. Where did that come from? That's the question.
Where does it come from?
I can tell what he said. I'm just curious to see if you agree.
I don't know where it comes from.
Childhood trauma.
Shit.
Everybody. I've achieved something decent, I hope.
That's interesting.
I had severe childhood trauma.
Same. One in four men are physically abused, and I was physically abused from the age of 5 to 11 by a stepfather.
Let's see. You're a Raider and CEO. Doesn't fit at all. It's not fitting at all. He was completely wrong. I have to call him.
Have you asked that question to a lot of special operators and CEOs and get?
Oh,
the same
absolutely.
answer?
I don't know many CEOs, but I have a lot of SOF.
Yeah.
Here's how I usually ask us: did you have a spunky childhood? What the hell does that mean? I said, spunky is bad.
Spunky's bad. Yeah.
Because I'm trying not to trigger them. They go, yeah, I was got hit around a bit.
Smacked around a little bit.
Smacked around. Yeah. Another guy, I was talking to the CEO actually, and he was like, yeah, no, I had a great childhood. I don't know what you're talking about. And as I was leaving, he said, I was raped at 11. I was like, whoa. Hold on there. Wait. What?
Yeah.
You didn't miss that part? And then the next day, he was doing great. So his wife's coming back for her procedure. But that was like a classic. It's like, oh, no, I had an amazing childhood. It's like, I was just raped at 11. As I'm literally walking away. I said, do you see why I asked the question? That's why I asked spunky childhood.
That's interesting.
I don't think I've met an operator. I mean, there's a bunch here today. We can ask them.
No,
they all had spunky
there's
childhoods.
a trend. One of my best friends, it was a very similar thing. And you know what's interesting? A majority of them don't grow up with fathers.
Mm-hmm.
Yeah.
Of course.
There's absentee fathers in their life or abusive fathers.
Which is, I don't know which one is worse.
I don't know which one's worse. Yeah.
They're both bad. But let's talk about biology, why that happens.
Mm-hmm.
So I think the reason that happens is two things. Like my brother calls me BB, brother bulldog.
Mm-hmm.
Once I get in something, I'm just not like that. I don't understand the concept of that.
Yeah.
Nor do you, clearly,
Right.
or you wouldn't be sitting here.
Right.
But first of all, you've had to deal with adversity.
Mm-hmm.
And then that adversity gave you capability to get through where most people wouldn't.
Yeah.
In order to, like, I really don't know Raiders training, but I had a close friend who was he was a Ranger. Mm-hmm. And he said, I basically would not give up. You have to go through all this. I was like, everybody else, like, oh, I can't handle it. It's like, I'm used to this crap.
I made a video about that is how I made it. And you get to a place to where you're like, well, I'm either going to make it or I'm going to die.
Yeah, I get it.
There is no quit.
Like, I don't understand quitting.
I will just die here doing this thing. Like, I'll just drive my body and mind into the ground and I'll die, or I'll finish.
Let me ask you this question. Have you ever heard the term hormesis? So it's a technical term. So it was coined in the 19th century.
Okay.
So some guy was playing around with fungi. So he gave him fungicide. Not enough to kill, but close.
Yeah.
So the survivors was twice as strong, the fungi. So then nowadays we look at the DNA. It turns the DNA changes. So when they didn't kill you, your DNA actually activated certain genes that makes you even more resilient. That's how it's built. So it's called hormesis. I think it's a fascinating idea.
That is fascinating.
It's true. You could actually demonstrate it.
Humans' ability to adapt and overcome and in spite of trauma and all the stuff in life.
It's beautiful.
Yeah, it is beautiful. Just shows you what we're really truly capable of.
Yeah. And the other thing that's interesting, have you heard of epigenetics? Mm-hmm. So the whole concept that somebody's traumatized, let's say,
Right.
you can pass that down 2-3 generations is mind-boggling to me. So my grandfather had horrible shit happen to him in Ukraine.
Yeah.
Then you get to my father. My father was a flyer in World War II.
Oh my goodness.
So out of 10,000 flyers, 100 made it home. He gave PTSD to my mother. It's called secondary PTSD, so you can catch it. And she took her life. All of that made me a lot stronger. So when people like give me grief, it's like, you have no idea what I've been. It's like, really appreciate, but it's about you. It's about you. Go away. Go away. You're a peasant.
Right. Yeah. Amazing. So where do you practice out of?
Chicago.
Chicago.
So I'll give you my number. Maybe you want to come in and we'll take care of you.
You know what's funny? Check this out. I'm in Chicago.
Oh yeah, when?
Next week.
Strikingly, I am too. Yeah, can you come by on Thursday?
Let me see what day it is.
That would be funny. That'd be funny.
Hold on. Where's my
I'm loading him up mine right now.
dates? Here it is. Texas. Oh no. 27th, 29th April, I'll be in Chicago. I'll come see you.
Let me look at it. Just want to make sure. I think I think I'm around.
I'll find you.
Yeah, we'll figure everything. We'll just exchange our numbers.
Okay.
But I think you'll see your function will improve. What date?
27th through 29th.
27th through 20. I can come in and do a procedure for you earlier. No problem. Yeah, we'll take care of it. Sure. Yeah, we'll do it then. Yeah, so, I mean, again, so the key couple of things that I think I'm really big at, like a lot of times when I bring operators, I like to bring their family to treat everybody.
Yeah.
Because if you think of it like
I was already thinking, I was like, I'll bring my wife.
It makes a huge difference.
Yeah.
Because if you think about it, if you fix you and she's unhappy,
Yeah.
there's a lot of problems with that. And then you feel bad that she's unhappy, right? So I also sometimes bring in children. So the youngest I go is 8.
Yeah.
I think the effect is so much more significant when the whole family is like
Down-regulated.
down, right?
Yeah.
Like everybody's down. It was cute. I took care of this hedge fund guy, and he came back, and somebody stole like $20 million from him. And he was pretty traumatized by that.
I would say so.
Yeah. So he was like, whatever. It's part of life. Anyway, yeah, it's like, okay, extra. It was just extra.
Yeah.
Anyway, so after I treated him, he sent me a message from his 5-year-old daughter. Cutest little thing. She said, "Thanks for getting my daddy nice again."
Dang.
Isn't that cute?
Dang.
It's like the cutest thing.
Yeah. Wow.
Oh, one more thing I got to tell you. I'm sorry.
Yeah.
I know. It's like, blah, 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 blah. So, stellate affects infertility. And I wrote a chapter on it, whatever. But we had this patient. He came in. He was a firefighter. He came in with his wife. They both got treated. He calls me back 2 years later. He said, "I'm feeling great, doc." I go, great. He said, "You don't understand. We had a child." I said, "That's great. Congratulations." He said, "No, we've been trying for 10 years. We conceived the day after the block." So guess what they named the child? Not Eugene, thankfully.
Yeah.
It's a cute blonde. What do you think? Take a guess.
Stella?
No.
Not.
Jordan, for Michael Jordan.
Is it an inflammation thing?
Yeah. So I think what it does is a couple of things. One, we talked about PTSD suppress sexual function.
Right.
So no equipment, no go, right?
Right.
Even if the equipment is up, because,
But your LH is down because of, right. Okay.
Right. Well, it also, in order to build up the endometrium, lining of the uterus, if you have too much sympathetic tone, it never builds up the endometrium.
Yeah.
So it never gets thick, so that women have intermittent periods and all that. So they can never get enough thickness, which is really crucial. To the immune, the inflammation, because when women conceive, the immune system, if it's confused, starts to attack that, right? And it kills it before it gets anywhere. So if you can reduce the inflammation, again, back to the inflammation, you can conceive.
Wow.
Isn't that crazy?
Wow. I want everybody to listen to this podcast. Every single
Anything
one.
I can do to help promote it, I'm happy to do it. You have a lot more capability than I do.
Yeah, we'll do our best. Wow.
Not interesting. It's inflammation.
Yeah.
And this I call her our first SGB baby.
Yeah.
I did a TEDx in San Miguel 3 weeks ago. So my episode will be out. I'll send it to you as soon as I get it. But it's such a beautiful, happy story.
That is
they have
amazing.
a child.
Yeah, absolutely.
Right?
Yeah. That's just struggling for so long. And I know that's a heavy weight on people. Like
It is. It destroys the whole family.
I've got 4, two naturally. And then my third with my wife, Allie, we had to do IVF because I had a vasectomy. So they went in, took it all out. That's why I came off testosterone. Horrible plan. It was a nightmare, but we got it done. And,
but it worked. So
it worked.
That's key.
Yeah, it worked. And then, but man, just going through that, I mean, we had a whole bunch of tons. I mean,
It's traumatizing like crazy.
and then the hormones on her, like what they're having to do with her.
Oh, God.
Yeah. So,
Clomid.
yeah, all
They
of
go
it.
nuts.
The shots and the
They
shots.
They start crawling the walls.
Yeah, the shots every single day, and
I
like
know.
she just looked. It was just horrible. We did that 3 rounds before we had him, and then after him, we tried 5 more times and nothing took. And that's
Your
so
poor
we,
wife.
Yeah, so
Ouch.
and I said, well, we're done. I actually had a vasectomy reversal. And
Did that help?
Didn't take.
Did that
No,
work?
it didn't take. Yeah. It was too long. I had a vasectomy in 2007, and then I had a vasectomy reversal like a couple years ago.
Yeah,
It was just
that's
too long.
hard. Too scarred.
The
much scarring.
urologist, great urologist, and he was like, "Listen, this is a 50-50 shot."
Yeah, it's not easy.
Yeah,
It's
one. We can't even use your left side because that's the side we use for the surgery for the epididymis removal of the sperm. He's like, so that side.
So they harvested from there.
Yeah, so they harvested from that side. He's like, so we're only going to connect one side. He goes, and it's a 50-50 shot at that. It's
Don't be greedy. You have plenty of children.
Yeah, so now we adopted, so now we've got the baby crying downstairs. That was ours too.
That was yours?
Yeah, so now we got 4. So.
Oh, that's gonna help you sleep so much.
Yeah, right.
That's so great.
Yeah. We're just now coming out of he's sleeping through the night now, so we're back to pretty much normal sleeps. But anyways, yes, I'll see you in April, and thank you so much for sharing some time with me.
Thank you. Thanks.
And
for
if somebody's interested in this, how can they? What's the best way to like figure out an avenue for them to?
Yeah,
to
absolutely.
get this
So if you
treatment?
go to stellamentalhealth.com, I'm a CMO. So I'm not the only one who does it for our company. There are plenty of excellent physicians around the country. Some not the best.
Yeah.
So everybody, at least in my purview, does a good job. But stellamentalhealth.com, make sure the people who do it are trained. That means anesthesiology or other specialty trained have done a fellowship.
Okay.
Make sure they do ultrasound guidance.
Yeah.
That's the only way to do it. So people who say they're going to do it blind,
Yeah.
run and report them. I think that's bad. I've seen a chiropractic doctor doing it blind. He's a chiropractor. He's not even trained in any of that.
That's crazy.
I was like, what? So make sure it's really safe.
Yeah.
And again, Stella Mental Health is the name of our organization. Also, sorry about that.
No, fine. We can put the link in the show notes.
The other thing is my website is eugenelipov.com.
Okay.
That has all the papers. So if you're interested in the sciencey part, the stuff I've been talking about, like sexual dysfunction, mechanisms, publications, all that stuff, go to my website. It has tons of information.
Brandon, make sure that those are in there.
And the last piece I would like to ask, if it's possible, I'm trying to change the name PTSD to PTSI.
Yeah. I agree with that.
Right?
Yeah.
So I did a survey of 3,000 people, and it said most people agree that the name should be changed. So I went to American Psychiatric Association 2024, and they said, not enough data. 3,000 people. So I'm trying to get 100,000 people maybe. So if you can go on the website, itsptsi.com, just fill out the link if you can.
Done. Yeah, we'll
That's
push
it.
that out as well. There's just 3 links. Click all 3 of them. All right.
Thank you so much.
Yeah, thank you.
Thanks for
Doctor.
having me.
Yeah, bye.